Everybody, and welcome back to Fiesta Friday. Now, May, you may not know, is Child Mental Health Awareness Month, and joining me more to talk about this topic, our Behavioral Health Director, Dr. Lily Perez, over there on the right. Half a day, Lily.
Hi.
And, of course, Annie Umpinko. She is the Administrator for the Child Adolescent Services Division. Half a day to you both.
Thank you.
Yeah.
Okay. There's going to be a lot going on, Annie, this week to commemorate some of the work that the systems of care provide on this island and everything like that. So what are some of those activities?
Some of the activities, actually the first week in May is Children's Mental Health Week. The whole month is Mental Health Month. So we are celebrating children's mental health between Project Carino and Ifamagonta. We had the proclamation yesterday signed by Lieutenant Governor Ray Tenorio. And that was a nice gathering of families and stakeholders. And then on Sunday, we have two masses. And the mass is to offer wellness for our island. And that is one at the cathedral at 7:30 in the morning for early birds. And then 10:30 at St. Jude in Sinahanya. Yeah, then after that, we have an open house on Tuesday for Project Carino. And on Thursday, we have the open house for Ifamagonta. At the open house, we are honoring also, we have the annual Ambassador Award, Systems of Care Award for school personnel that has contributed and made a difference to a student's life. So we have 1 to 1-8 that's going to be recognized for that at the open house on Thursday at 4 o'clock. It starts from 1 to 4. And then on Friday, we have the WAVE between Project Carino and Ifamagonta and the Department of Mental Health or Guam Behavioral Health. The WAVE, awareness WAVE, to kind of bring the public to that awareness that children's mental health matters, and really our own mental health matters too. So that's kind of the highlight of the week.
Okay, well, Dr. Perez, your organization, Project Carino, is kind of like the new kid on the block, not to, leverage a pun there.
Exactly.
But, like Ifamagonta is a little bit more, tenured in helping this. But what does your organization bring to the table to supplement and complement as well the services that they provide?
Well, I think it was the success actually of Ifamagonta working with kids that are 6 and up, and recognizing that, what about the younger kids that are that might also have some concerns, and so that's where Project Carino comes into play. So we work with children from birth to 5 and their families, and so we work with the little ones, and we really do screening initially to see kind of where they are developmentally, and then social-emotionally, where are they in terms of, are they about where they should be, are their scores a little off the chart, and then do further assessments. So if we resolve the issues early, then we don't have to refer them to Ifamagonta.
That's the goal.
Yes, that's the goal. So the fewer referrals we have between us, the better for the child and family.
Sure.
Yeah, but there are some situations, especially in conditions where parents might have a behavioral health issue and it's hereditary, and we start to see the presentation in the younger children, then we refer them to Ifamagonta.
And what are some of the more common behavioral afflictions, I say, like if, for lack of a better term, that we see here on Guam? And is there a greater concentration here of certain behavioral patterns than there might be in the States?
I think when we had the evaluation on Ifamagonta, the top ranking diagnosis is attention deficit hyperactive disorder. And nowadays that's often kind of combined with bipolar disorder, or if it's not ADHD, it's bipolar, or vice versa. So that's one of the higher ones. Depression is also high. And the depression sometimes is brought about by bullying at school, and the child is not able to cope with that, so they start missing school. They're truant, they're not going to school. So that becomes another issue that oftentimes involves the court, because if you're truant so many days, you get reported, and then you become involved with the court system. And then we have, of course, conduct disorder, where kids are oppositional and they're just not following the structure at home, or maybe there's no structure at home, so they're kind of on their own and they get themselves in trouble.
That's a good point. You can either have a poor structure or no structure at all, and you're left to fend for yourselves. Okay, real quick, and we'll start with you, Dr. Perez. What number can people call if they'd like to know more about your organization?
478-5400 or 01. They can also check out our website, www.projectcarino.org.
Okay, and how about you, Ann?
477-5338 or 5349, and I just want to show this. This is what we're going to wave at the Wave this Friday.
Oh, very lovely. Well, thank you, ladies.
Thank you.
Muchas gracias.
Thank you, too.
Buen provecho.
All right. Stay tuned. We're back after this.